Good evening. Welcome everyone to our presentation on clinical care for autistic adults and Autism Adult Health Resources. Here's a brief outline of how things are hopefully going to go. And we're going to jump right in and start with Dr. Chris McDougle talking about the clinical course for providers, clinical care for autistic adults. Take it away, Chris.
Well, good evening, everybody. Thanks for joining us. I'm the director of the Lurie Center for Autism. And as you know, we take care of lots of adults as well as children and adolescents. We're one of the few centers in the world that does that. But we like doing that. And this evening's presentation focuses on a educational program that was funded by the Nancy Lurie Marks Family Foundation and created by Harvard Medical School. And Sarah and I were very involved in the creation of this program, and it's really good. If you know me, you know I kind of just tell the truth, like whatever I think. This is really good because the people that know how to put together something well, we gave the information, but they made it look really nice and easy to use. So it's focused on the care of adults with autism, which is kind of unusual. And it's directed toward clinicians, nurses, hospital administrators, patients, parents, anybody. And it's free. And it's about a 4-hour course. And it's probably the best course on adults with autism I've ever seen in my life. So I would encourage you to watch it. I'd probably also encourage you to send it to your doctors so they can learn how to do this, right? So it's really in two parts. I'm going to start talking about the part about clinical care for autistic adults, and Sarah is then going to talk to you about the element that's more directed toward parents and patients and advocates and that kind of thing. Next slide. So I said some of this. Doctors can get CME credit for this for free, so that's something they will do. And they might also learn something along the way. Next slide. And it's broken down into 4 different modules, and there's a logic to it. The first module is more introductory. So you can see we talk about misconceptions and facts about autism. We're all knowledgeable about it, but most of the world has thoughts that probably aren't true. And we want to make sure they understand what we're talking about. It talks about the way that individuals with autism can present clinically, and we all know about the wide range and the heterogeneity, how you make the diagnosis, the medical and psychiatric comorbidity. So we want the doctors to know what kind of medical problems are common in our folks and what kind of psychiatric disorders are common. Because not too many people understand that. Next slide. The second module is a little bit more in other people's domain than mine. Informed consent, how do doctors, things like guardianship, and how do we know we can take care of your adult child, and preventative health. A lot of people don't think that people with autism can develop medical problems like cancer. They never thought about it. They never thought that was possible, or heart disease. They think that only happens to you and me. So we have to start with the basics and educate people. nutrition and physical activity. I know a lot of people on the call. I was speaking to this, what do you want to call yourself? I won't point you out, but yesterday with her daughter, and she's like a nutritionist. She uses fancy words now, dietitian and things. And anyway, preventative health is something that's very important, right? Um, Individuals that are nonverbal can't really talk to their doctor about describe their preventative health that they want to receive. So, how do we go about doctors knowing how to interact with somebody that can't answer their questions? Because they assume you just ask the question, you get the answer. So it's basic stuff for us, but not for the rest of the world. And you can see some of these important medical preventative care things. I was on a call today with a bunch of parents of aging adult with autism, and one lady said it's gonna, her Blue Cross, or not her Blue Cross, her Medicare, Medicaid doesn't cover the dental expense. It's going to be $50,000 to take care of her adult child's teeth. And she only knew there was a problem because she stepped on one of his teeth that had fallen out of his mouth. So I'm just telling you that, these people don't get the kind of screening that we take for granted. Next slide. This one is very important. When we came to the Lurie Center in 2011, we had some idea how to organize a clinic. I'm talking about just the basic layout, because we took care of all the adults in the state of Indiana before we came here, and they weren't very happy when we left, you know. But we got them off to a good start. But Ann Geock, our administrator at the Lurie Center, she understands all this stuff. When we first got here, we only had half of the building, but we're going to take over everything pretty as quick as we can, which we did. But how do you design a waiting room? How do you design a waiting room for adults with autism who can be irritable and aggressive, and then you have 2-year-old babies coming in? You have to think about things like that. What happens when you have a major aggressive outburst in the waiting room and the patient jumps over the front desks and grabs scissors, starts stabbing around? We got to take them down. What are you going to do? Is it better to have 100 people come and get involved, or 1 or 2? Do you have a room where you can take them? All those kind of things. Can you imagine regular PCPs having to deal with this stuff? That's why they say they don't have any room in their practice, right? I'm full, etc. Well, that's not a good enough excuse anymore, because the Lurie Center can't take care of everybody. We can only help a small percentage, honestly. So this course is designed to show them how they can set their office up, what other kinds of people need to be working there to provide support. If you have knowledge, you're less anxious and afraid, but I can understand why doctors in the community are afraid to do this, because they've never been exposed to it or taught in medical school or residency. So that's why we have to do these kind of courses. Next slide. And this was an interesting module too. I will tell you, there are lots of videos of parents, real parents, and real patients, and real doctors talking about how to do this. So you'll see me on there doing a bunch of stuff. You want to dial in and see that. And this is a mother that I know, certainly, but the videos are really good. They're well done, and there are a lot of sort of case examples, and those are the kind of things that doctors like. They don't want to just get a lecture. It's more impressive. It makes a bigger imprint on their brain if they can see something that relates to an actual patient or parent. Next slide. Yeah, so I don't know, Sarah told me today something like 2,500 people have viewed this already. I don't know if that sounds like a big number or not. I'm not sure. But it seems like it's getting bigger all the time. And people are wanting to show this. Sarah told me today somebody wants to show this in Cleveland. And is that okay? Well, I suppose it's okay because it's a good thing. And that's what we want to see happen. That's what the Nancy Lurie Marks Family Foundation wants to see happen. This is really designed to educate people throughout the world about adults with autism. So that might be about it for me. I'll have to see what the next slide looks like. Yes. So Sarah is going to take over and talk about the other component of the program. And then after that, we'll do questions and answers. Sarah's going to introduce herself. I can tell you she's a very organized, lovely person. Who's top notch, right? As far as organizing things, she's like a Harvard MIT type, and she keeps me organized and in line. And so I just have to come on and ramble a little bit, and then she takes over. So go ahead, Sarah. Can't hear you.
I'm a dope. Okay.
She's perfect, other than sometimes she forgets to unmute herself.
Well, it just shows that I'm like everybody else and I forget to unmute myself. But anyway, so thank you, Chris, for that lovely vote of confidence and introduction, despite the fact that I was muted. I want to add to what you were just saying. I meant to tell you earlier today, our numbers are over 2,500, and we have clinicians taking the course in all 50 states already and in 104 countries around the world. So our reach is already really terrific, and we are hoping that we will continue, especially with these other presentations, to bring more people in to taking the course. And we'll show you how you can sign up for the course, as well as tool around the site. I'm honored to have served as the voice of lived experience on this project and to work with Chris and all of the wonderful people at the medical school in Lurie. There are so many different voices in the autism community that need to be heard, and we have worked very hard to try and listen and respond to the vast people in the adult community who need our help. As part of that, preparing for the course and the site, in order to reflect and represent the diversity of the adult autism community, we assembled a patient experience board to advise us as we developed our content for the course and the site. We took care to recruit people from different areas of the country with different presentations of autism, and we were especially mindful to include caregivers and siblings of older patients with more challenging forms of autism. The FEB discussions we had influenced the topics chosen for each of the course modules, the tools that were developed by our instructional designers, and the multiple ways of presenting information in both the course and the site. We reached out also to self-advocates in our local community, as well as subject matter experts who could review and supplement our content. We're so thankful to everyone who shared their time and expertise with us. What an amazing experience. I'm the parent of an adult with autism, but I can say I learned something new every single day in the 3 years that I've been working on this project. Absolutely amazing group of people. The website itself is based largely, the content on the site is based largely on the content found in the clinical course, because we know that the medical experts that Chris recruited to teach in that course are world-class. And the information that they share with the PCPs and providers that we hope will take the course is also important for families to know as well. The site is designed to guide users to the content they want in a variety of ways. And it's sorted in one way in the 3 key stages of adult life that everyone journeys through, which is young adulthood, midlife, and mature adulthood. We also tried to identify key categories so that people could find what they needed easily: caregiver guidance, care transitions, communication strategies, common conditions, insurance, staying healthy, gender-specific care, and legal matters. Much of our content links out to sites that have a reputation for giving people the resources they need. We cannot answer every question, but we do our best to link out to reputable sites where you know that the information that you get for the help that you need is accurate and up to date. So our overarching goal is to provide practical advice and useful tools that will help patients communicate effectively with their clinicians and service providers, support caregivers in advocating for their autistic adults, allow caregivers to effectively prepare for emergencies and plan for the future. And again, we do it in a multiple formats so that people can get the information that they need, and they can download it, print it, put it on their phone, take it with them, show it to their providers in any way they can so that the communication is effective and streamlined. This ASD communication tip sheet you hear is something that's from the clinical course, and it's instructions to providers about the special needs that autistic adults have that they may not anticipate in their regular practice. So I'm going to give you a quick tour of the site, but these are the links to the site, and there's a link to the site in the chat. And please post questions in the chat, but I'm going to give you a quick tour of the site itself. So I'm going to unshare this and then move back to sharing again. So this is Adult Autism Health Resources. This is what you'll find when you click on that link in the chat. And the important thing I want to show you right now is here you see the link to the clinician course. And if you click on that, it takes you to the course. Anyone can register for the course. You don't have to be a clinician. But when you register, I want to show you how you register when you're not a clinician. Scroll down. The registration type for parents, self-advocates, family members is allied health professional and other. And that will get you in. So that's how you register for the course. It's 4 hours. It's worth every minute of your time. A lot of you will be familiar with the experts that you see on there. I just can't recommend it highly enough. Chris has just assembled a world-class group of people. So when you tour through the site, you see the different stages of life. And something that we have worked very hard to focus on is autism competent care. And we coined the phrase autism competent care because offices don't need to be autism friendly. They need to be autism competent. They need to know what autistic adults need and be able to meet those needs. So with that in mind, we have something that people can print out and take to their clinicians about what an autism competent office looks like and how the space can look and what they can do about noises and smells and directions to the bathroom. And it's just a fantastic, fantastic resource. I can't say enough good things about it. So downloadable resources. We've also got a video that also has the same information for people who need visual cues, which many of us do. And again, Chris's staff was absolutely amazing in helping us put this together. So you see the underlining here, those are the external links, the links within the site. They'll also take you outside the site. If you need to find something specific, if you're looking for information about, say, anxiety, you can go to our resource page, type it in, and it will show you all of the articles that discuss anxiety. And you can find out information about medication. You can find videos about doctors talking about medication. You can find external links to other sites that will give you the information that you need. We have all of these different ways that you can move through the site and find what you need. Let me see, I think the other thing I want to show you is our toolkit. And in the toolkit, again, we talk about autism competent care. And the transition to adult care, which is something that many parents are worried about. And there's a whole guide where you can fill this out so that you have something to guide you through a medical appointment. So many of us, even when we're going to the doctors for ourselves, we go in, we have things we're going to talk about, and then we don't get to everything we need to talk about. This gives the doctor the questions and the answers that they need so that by the time you leave the office, you've gotten the questions answered that you went in to get answered. So much gets lost. Oops, I'm sorry, apologize. So much can get lost in the stress of a medical visit. One more thing. So we have our life transitions, and you can find the same information in different formats depending on what works for you. We have downloadable charts. We have a video of Chris talking about getting an autism diagnosis. We have an article about an autism diagnosis, and we have a question and answer about women and autism. We have many women, older women, who are getting diagnosed over 50, and they have a lot of questions, and we try to answer them.